Hi, guys, it's Dr. Sadaf, and I just wanted to give you an update as to what is going on. So, I have opened up my practice in Chappaqua, New York, and I'm currently accepting new patients. So, I want to invite you to come and become a patient of mine. If you've been listening to this podcast, you've been listening to the episodes, you are finding so much value in all of this. I want to invite you to become a patient of mine and come see the difference with a doctor that actually has time to listen to you and support you through the transitions that you may be experiencing, whether they're perimenopause, menopause, or you're experiencing any type of sexual dysfunction. And of course, I do annual GYN exams as well. So if you're not having any problems at all and you just need a regular exam done, I am more than happy to help you out. So make sure you check out the practice. It's called FemV Health, and the website for that is www.femvhealth.com. And make sure you look that up. The phone number for the practice is 914-538-2534. And make sure that you go and check it out. Check out the website and make sure you book your appointment today. Also, I have just started a new Facebook group. It's called It Might Be Menopause Support Group by Dr. Sadaf Lodi, FemV Health. And I'd love for you to come and join that Facebook group, because in that group, we'll be talking about different ways that you can get support and education as you go through this important transition in your life. It's also about building a community that is going through the same things that you are. Oftentimes we feel that when we go through things in our life that we are the only one, but I'm here to tell you that you are not alone, and that there are so many other women going through the same symptoms that you may be going through, whether it's hot flashes, night sweats, mood swings, vaginal dryness, pain with sex, brain fog, joint pain, dry eyes, any of those things, so come join us in that Facebook group. It's called It Might Be Menopause Support Group by Dr. Sadaf Lodi, and that's on Facebook. So come and join us in that community, and I definitely look forward to welcoming you there. And make sure that if you have any questions about any of the podcasts that I do, that you either DM me or email me, and I will create a podcast just for you, because you are a loyal listener and subscriber, and I would love to answer any and all of your questions. So if you have any burning questions that you are wondering about, please make sure that you email me at hello@femvhealth.com and let me know about your questions, or DM me on Instagram or TikTok, and I'll create an episode just for you. And as always, make sure you like, share, and subscribe to this podcast. As you know, I am looking to get over 100,000 downloads by the end of this year, and I'd love for you to help me out in that endeavor. And so please share and like these podcasts, download them, and let all your family and friends know, because I know there is not much information out there, and some of the information out there is not actually factual. So you want to make sure that you are getting your medical information from a board certified OBGYN that knows and has studied all of this material, whether it's sexual medicine, perimenopause, or menopause. So looking forward to hearing from you. And now to the episode. I am an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf Lodi, and this episode is everything you need to know about adolescent medicine and how to talk to your kids about intimacy and relationships and puberty and all that great stuff. But first thing that I want to say before we get into it is that I'm not giving any type of medical advice. So if you're having any issues with your health or really want to get into how to talk to your kids and puberty and all this stuff, and make sure you make an appointment with your primary care doctor. And I'm definitely not giving any type of religious advice. This is the Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. So today I am very excited to have on with me Dr. Loretta Duggan from Atlanta, Georgia. Is that right?
So I'm a little bit outside of Atlanta in Athens. So depending on traffic, you can get to us in about an hour and a half from Atlanta.
All right.
Just all depends on traffic out of Atlanta.
All right. Very good. So for those individuals that are listening or watching, if you could please introduce yourself.
Absolutely. And thank you so much for having me. I'm excited to be here. Hello, everyone. My name is Dr. Loretta Duggan. I am a primary care physician trained in family and adolescent medicine and owner of Her Health here in Athens,
Oh,
Georgia.
that's right.
Yes. We started in June, so it's been really exciting. And I help teens and young adult ladies 11 to 26 as they're transitioning to and through puberty to confidently embrace their menstrual health, their reproductive as well as sexual health, to really live the life that they choose. So I'm excited to be here today.
That's amazing. I love it. So, I am really interested in now. So I don't have girls, I just have boys. So I never
Hmm.
had to have that puberty conversation about, the menstrual cycle and the
Right.
changes that happen for girls, because I have boys. But
Hmm.
I'd be really interested and curious, and I'm sure some of the listeners may be curious as well, as to how you approach that conversation with, say, like your patients and what advice you give to your parents that come and see you.
Right, absolutely. And it's a huge thing because it's more so setting the expectation, just like we would with, say, starting a new medication, and things to look out for and when to call us. And so one of the first thing is really just laying out things that they should look for or get ready to look for as their child is getting ready to enter into puberty. A lot of people think about the mood changes and mood swings that the girls have. One of the first things that we'll see physically in our ladies, though, would be the changes in their breasts. So they may start to have breast budding that's there, and it can be a sensitive topic, right? So some girls may be uncomfortable, even parents may be uncomfortable with that. But one way you can broach it is, "Hey, I noticed that you look like you're changing a little bit. Is this anything that you've actually noticed or thought about, or anything that's concerning for you?" You can even incorporate, say, their peers. Have you and your girlfriends or any of your friends started talking about changes that are going on with your body? Because a lot of times they may already be talking about it, but they just may not be talking about it with their parents or with their guardians. And
That's
so
right.
just kind of gauging where they already are and starting from there and still broaching it. You still want to bring it up because that will help them to feel more comfortable as well in coming to you about these things. So the breasts are usually the first things to start, and then you can get into conversations about bras and would you want me to go shopping with you, or have you all looked at anything, have you looked at anything before in terms of getting ready to dress this new body that's starting to evolve. So the breasts are usually first. The other thing they may start to see is hair growth. Hair growth, not just on arms and legs, but we're talking about underarms as well as pubic area. Those may start to show signs of growth where it's coarser, where the hair is thicker. And with that, they may start to develop odor as well because those glands are developing too. So, body odors, even acne, like on their face, and learning how to, like I say, care for themselves, making sure to wash not just with water, not just a splash here or there, but actually with soap. So, it's going to be helpful. And using deodorant.
I,
It may be something that they just don't think about.
it's funny you say that. I don't want to interrupt you, but I was just thinking that, like, like my boys, after they come from working out or whatever,
Mm-hmm.
the
Yep.
showers are literally, well, they can vary. Sometimes they're like 5 minutes. And I'm like, do you
Like,
apply
no, no,
soap
no.
when you took the shower?
Right.
Like, I don't really know what you did. And other times they're in there for like years. And I'm like, for God's sake, you need to
Yes,
come out of the shower.
that's
But
right.
like, yeah, that one that they come out in 5 minutes, I'm like, I don't really know what you did in
Yeah,
there.
we're going to send you back and let you try again for round two for
Exactly.
that 5 minute
Yeah.
shower.
Yeah, exactly. Exactly. I
Yes,
know.
yes.
So you're right, with that body odor and, all that hair that starts to come about. And
Mm-hmm.
I'm so glad that you bring that up because, I think that the physician is a great person to bring it up. But of course, I'm sure you also mention it to the parents. And do you ever give a handout to the parents regarding puberty and the changes that they can expect? Or Do you have a conversation separate from the mom, from the, from your patient that's a child or adolescent? How do you do that?
Right. So I try to start off with them together. So if their parent or guardian has any specific concerns, we try to address those first. And then I always want to leave time at some point in the visit to just talk to my teen or young adult on their own if someone came in with them to the visit. Because sometimes it may be things that they're just not comfortable with discussing with anyone else in the room, which is understandable. And so we want to allow that time in between all the clicking and metrics that we're trying to meet as busy, doctors and healthcare professionals. But we still want to make sure to not lose their voice as well and their own concerns throughout that. A couple other things I want to mention too
Yeah.
was the growth spurt that we
Yes.
can look out for with our ladies. And then usually about a couple of years after their breast changes have started, that's when we can expect to see periods, what's known as menarche, where their periods are starting. And even then, it may not be regular, right? It can still take a couple of years for those periods to actually kind of get on track, some type of normalcy,
Mhm.
that they can kind of know what to look out for every month. And really, that's kind of towards the end of puberty for young ladies. It seems like it's like the periods are the big thing. Yes, but the body's been changing through stages the whole time. And now it's kind of like the grand finale with ladies starting their periods.
That's so funny that you call it the grand finale. Did you watch that movie? Are You There, God? It's Me, Margaret.
Not yet. I heard it was a great movie,
It was.
though.
I really liked it. I read the book too when I was younger. When it's one of those coming of age books when you're like in elementary school, and then when that movie came out, I thought it was fantastic. I thought it was really good because I think it really kind of shows the way as you get older, kind of the emotions and things like that you have. I guess one of the cartoon movies also had, I think, Inside Out too, or anything.
Mm-hmm.
I
Yeah.
think we also talked about that. But, I think that it's really good that you go over what to expect and what's going to happen in puberty. Now, have you noticed that once the kids get like their growth spurts and they have menarche where they start having their periods, do they
Mhm.
grow anymore after that or no? Are they pretty much done?
So it may be a little bit more growth left for our girls. Girls, we just take off faster than our counterparts than the guys do. So a lot of times we're getting towards the end of our growth. Once our periods are starting to get regulated, those growth plates are close to or almost closed at that point.
That's so good to know. I think that's really important, especially for parents that, perhaps their child is on the shorter side. And so
Mm-hmm.
it's really important if you're going to go see an endocrinologist or somebody, like, say, for example, if you're really worried about that height,
Mm-hmm.
really important to see your endocrinologist before
Want to
those
do it
growth plates,
sooner.
right?
That's
Before those
right.
growth plates close up, because then they're not going to be able to grow
They won't
anymore,
grow. Yep, they won't be growing much taller
right?
after that.
Yeah,
That's
I
so
think
true.
I think that's really important for, I'm glad you brought that up. Now, I'm sure you probably get this question a lot. And, what I find really interesting is how do you approach the topic of intimacy and relationships with your patients and, your adolescent patients to be more specific? So I'll give you a little story. So just recently, I had
Mhm,
a patient, I was on call at the hospital, and a woman came in and she's 18 and she was having her second child. And I thought, oh, okay.
mhm.
I
Wow,
asked her, I said, well, how old, were you when you had your first child? She told me she was 13.
wow.
And I said, wow. I said, okay, because that's probably the youngest that I've seen. I've had somebody in labor is 13. And,
Mhm.
I asked her, I said, what was it like taking care of a baby when you yourself are kind of, 13 is pretty young and they're
Right.
trying to figure out their own bodies and adolescence and all this stuff. And she said to me, she said it was really, really hard. because of that added responsibility. So what do you tell your patients? And of course, this is a podcast that's viewed throughout the world, and different cultures have different ideas
Right.
about when individuals get married. But what do you tell your patients that come on and that have children about intimacy in relationships?
Right. Such a great question to ask. And it's one of those, often uncomfortable ones.
Yeah,
But it needs to be had because they need to
right,
know what's like a healthier relationship or one that isn't, and understanding that intimacy is still a part of their overall health as well. And so, with that, one of the things I definitely don't want to say push one way or the other, right? I'm
right,
not pushing abstinence. I'm not pushing for them to have sex, but for them to, one, be ready and it be consensual.
right.
And then two, realizing that all actions have their consequences. So that kind of puts that responsibility on them. And we kind of talk it through, right? Because I want to know where is their mindset at that time as well, when it comes to relationships, or asking, okay, if you are with a partner, how comfortable do you feel talking to them about private issues? Or if they're asking you about sex, is that something you're comfortable with, or are you feeling pressured to do it? So, really, just knowing the standpoint of where they are and validating them in their experiences, right? Because it's going to be different for everyone, but still encouraging them, letting them know that I'm your advocate. I'm not here for your parents. I'm not here for the partner. I'm here for you. So tell me what it is that you need from me, or let me know, and we can kind of best come up with a plan or ways to incorporate intimacy so that it's not a fearful thing, it's not a pressure tactic for them, but something that can be comfortable. And most importantly, once they're ready, and again, once it's consent on both sides, not just one way.
Yeah, I think, one of the key things that I heard you say is consent. And I think that is one of
Mm-hmm.
the biggest things, to teach our children. I think that there definitely has to be consent. And I think that that
Yes.
is something that is definitely not taught in sex education. I did
Mm-hmm.
actually a talk about the sex education and the status of sex education here in the US. And a lot of times that sex education that somebody gets is really based on their zip code
Mm-hmm.
and where
Right.
they're located, right? And especially the board of education of that district or wherever you live. And based on that, that's what you're going to be taught. So whether that's a focus on abstinence, whether that's a focus
Mm-hmm.
on safe sex, whether that's a focus on sexually transmitted infections, you know,
Right.
I think oftentimes what's not talked about is one, consent, and two, intimate partner violence, right? I
Yes.
think that
Yes.
that's not discussed, and that's something that absolutely has to be discussed because I think that sometimes a lot of young individuals, adolescents that start to have intimacy or start to have sex or whatever, I think that sometimes one, there's a lot of pressure from,
Mm-hmm.
say their peers. I think
Right.
two, that there may even be, if they have a big age difference, we know that even a year difference is a big difference in the intellectual capacity, right? And of
Yes.
how a child is thinking. So sometimes there's like coercion, there's, and you definitely want to make sure that whatever the individual does or gets involved in is consensual and there's no
Absolutely.
type of, pressure that they feel if they're going to participate in something.
Exactly, exactly. And even with intimate partner violence, we're not just talking physical, we're talking about emotional as
Yes.
well. How are they talking to you?
Yeah.
A lot of times I'll ask them, okay, so tell me about your partner. Well, first of all, are you in a relationship? Okay. Is it male, female, or both? Okay. And tell me about your partner. What do they do? How old are they? Where are they? How do they treat you? Like, we
Yeah.
want to know these things as well, to give us a better idea overall of what that relationship looks like.
Yeah. Yeah, absolutely. I mean, I think that those are really, really solid and really important questions. And I see that also with, when you take a sexual history on a patient,
Mm,
to make sure that regardless of whatever the age is, right, of the individual, that
yes.
you're asking those key questions because you want to make sure that they are in a safe and healthy relationship and that, they're not being coerced or they're not being manipulated by their partners, right? And most of the time, right,
Right.
people have like decent relationships, but there are times where, somebody will come out and say that they don't feel safe or
Mhm.
that, they don't know if they're safe at home and things like that. And which is really important, especially for anyone that's listening, to be able to tell their physician, right? Because then
Yes.
that physician can try to help you out, get you in contact with perhaps some type of social services or whatever.
Right.
But
Different resources that may be local. Mhm.
exactly, exactly. But really important to share that information and communicate. So, how do you tell your patients, your young adolescent patients that may be sexually active, how do you tell them to practice safe sex?
Yes. So one is to confirm what does sex look like to them.
Yes.
So some may feel it's only penetration that's being sexually active, but oral sex counts as well, anal sex counts as well. And so I really just kind of list through those things to see where they are with it. And then I'm asking, okay, what are we doing to protect ourselves? Again, it's about advocating for the patient. And I let them know you only know what you're doing. You don't know what anybody else is up to, regardless of what they say.
I
So the
say that
best
all the
thing you
time.
can do, yes, we only know what we're doing.
Yeah.
So definitely taking the steps needed to protect themselves, whether it be condoms, whether it be PrEP for HIV prevention. Just kind of fitting in, making sure that they're screened. They have up to date sexually transmitted screening for infections and really making it a comfortable, open space to have these conversations. That's really the most important thing because if no one is comfortable, then these things will never come out. You may can ask the screening questions as much as you like. Whether your nurse do it, you do it. But if they aren't comfortable or they feel that maybe I don't know about them, then we may not come off as uncomfortable,
Right.
even as their healthcare providers. And so we want to create that space for them so that they will feel willing to share these really intimate topics, so we can best help them as well.
I think that's really important that you talk about creating that safe space, right?
Hmm.
We really, especially as providers, as physicians, we really want to make sure that we're creating that open, safe space for our patients so
Yes.
that they can trust us with really sensitive information, right? That they can be vulnerable because oftentimes, if they don't have that relationship with their doctor, they're not going to tell you
Right.
anything, right? And
Mm-mm.
just like what you said, you can create all the questions and questionnaires, but it
That's
doesn't mean
right.
it's not going to make a difference because if they don't feel comfortable with you, if they don't, right, like our coach said, if they don't know, like, and trust you, they're not going
That's
to tell
right.
that information to you. And then you're really not going to be able to help them. And then that, unfortunately, would be a huge disservice to those
Right.
patients.
Right. You won't get a full picture, a full scope
Yeah.
of what they may be dealing with or how you can even help if they're not comfortable sharing.
Absolutely. I'm really curious to know. And like, so for example, here in the Northeast, I'm in New York, you're in Georgia.
Hmm.
And here we've been seeing a resurgence of syphilis. And I'm
Mm.
curious to know, do you also find that in Atlanta? In Georgia?
That's okay. Yes, Georgia, we unfortunately at the top of the map for a lot of things, and not for always the best things. Syphilis, specifically congenital syphilis, has been on the rise here in Georgia. So now, in terms of screenings, particularly for pregnant patients, making sure that we're not just screening in the first trimester, but the third trimester as well, because we really want to make sure we're giving these babies the best chance. So it's definitely been a surgence. I think, don't quote me directly, but definitely since COVID, it's just been a huge spike with congenital syphilis, and they put us on the lookout for it as well, those that take care of our expectant moms just to make sure that they're screened to help prevent and treat
Right.
those that may develop congenital syphilis.
Right, right. Yeah, I mean, we've noticed that too. There's definitely been uptick with syphilis.
Mm-hmm.
Also, in terms of young adolescents that are sexually active, what type of sexually transmitted infections do you usually see? I mean, I can tell you that we usually see chlamydia mostly,
Mm-hmm.
some gonorrhea, some trichomonas, but really we see chlamydia a lot.
Yes, same. Chlamydia would be at the top of the list with gonorrhea and trick as well. The other sneaky one that we have to watch out for is HPV.
Oh yeah, definitely.
HPV, yeah, it's actually the most common STI, sexually transmitted infection. But for our younger folks, we start screening PAPs at 21, but we don't start checking specifically for HPV until 30, because for most healthy folks, they may can clear it on their own or handle the virus without much issue. So we
Right,
don't want to do unnecessary invasive things on younger patients in their
right,
20s.
right.
But yep, HPV is one to look out for as well. Anal, oral cancers, cervical cancer. So it's one to be aware of, but it's a little bit sneakier though as a virus, and there's not any specific guidelines for screening for it that I'm aware of for those younger than 30, unless there's some other circumstances that are going on.
Yeah, I think like sometimes what happens with those pap smears is that if they come out abnormal, then they'll do that reflex testing, right? Where you will get that
Mm-hmm.
reflex HPV to know whether or not they have,
The virus there.
positive, right, correct. If they have that virus,
Mm-hmm.
and, what strain it is, the 16 and 18. But you're
Right.
right. Like routinely, we don't do that HPV on those individuals unless the pap smear comes out abnormal, and then they have that reflex testing where they will check for that HPV. I
Mm-hmm.
know that herpes as well, right?
Mm-hmm.
Other individuals, you tend to see that a little bit more. Do you see herpes as much over there in Georgia?
I won't say as much. And herpes is kind of different too because it's a virus. It doesn't necessarily go away, but you can have flares of it. And so with testing for it, I try to be a little more, how should I say it? I want to make sure when I test that I let them know if it comes back positive, but you're feeling okay, then we watch, because it's one of those things where they're like, oh my God, I'm positive for it. What do I do? How do I get rid of it? And there's no quote unquote getting rid of herpes once you have it. It's more so treating it, or keeping yourself healthy, decreasing the stress, so that hopefully you won't have flares or mini flares at all. And if so,
Right.
you let your doctor know. It can definitely be treated, but you have to take care of yourself, or if you're otherwise healthy, kind of like HPV, your body can keep it in check as well.
Yeah. Yeah. I feel that, with herpes, once you have it, though, unfortunately, you have it kind of forever and it stays in what
Hmm.
we call the dorsal ganglia
Yes,
of the nerve root. So it's, but like Dr. Duggan said, that we just really try to keep it in check. And if you have flares, we treat them. You can also go on suppressive therapy for herpes.
true. If
Uh,
you're having recurrent outbreaks
right.
with
Right.
herpes.
Exactly.
Hmm.
Yep. And try to prevent that. So, I think all of this is really important information, especially for, really anyone, but also for young adults, because I think that oftentimes there's perhaps a stigma asking about sexual health, asking about prevention. And unless you have a doctor such as yourself that's, talking to them about safe sex practices, they may not have anyone else to talk to about this. And these are very sensitive topics, and their parents may not even know that they are sexually active, right? I'm sure you see that a lot. I know I've seen that in the clinics that I work at, where the individuals will ask that their parent, they'll ask to kind of be seen alone, so you get permission from their parents, and then they'll tell you more than their parents even know, or that they're sexually active but their parents don't know and they don't want their parents to know, and things like that. So
Hmm.
it's it's really important that as a physician or provider that we provide that, again, that safe space for young adults to kind of let us know what's going on so that we can best serve them.
Absolutely. And working to ensure that confidentiality, right? Letting them know that what you tell me is confidential
Right.
unless there are thoughts of you hurting yourself, someone else, abuse. Okay, those things are off the table. But everything else is you and I, we're having a conversation, we're figuring out what's the best plan, what's the best route to help you be your best. And yeah, that's what I would definitely want to ensure, that confidentiality piece.
Right, absolutely, absolutely. So, are there any other things that you think our listeners should know about? Let's say they're going to go see their doctor about their adolescent visit. Something that you always stress in your practice, something that you always make sure that you cover with them. Anything that you want to make sure that they also address with their providers.
Hmm. I do think, and it depends on provider comfort as well, right? Sometimes, I won't say sometimes, but with our training, talking about intimacy, talking about sex, those aren't things that are at the top of, the list to make sure to know. They're not our board questions a lot of the time. So it really gets pushed to the background until people like you, docs like me, others maybe in adolescent medicine, we want to make sure that this isn't um, absent. We want to make sure that it's known that this is part of your whole health as well. Not something to be on the sideline, but it's actually part of the main picture as well, as they're starting through their journey to and through, say with puberty. And
Mhm.
just making sure that they know that they have an advocate. They have someone that's here for them. Yes, when I was full family practice, I may see generations, of families, but to still let them know, hey, we're not talking about mama's problems today. We're not talking about grandma's problems today. We're here to talk about you. So you definitely let me know. And so that's important. And I want to make sure that I stress that to all my families, because I want the family to know too, hey, at some point, I'm going to have you exit in the room. But then more importantly, for a patient to know that I am here to advocate for you.
Yeah, I love that because you're preaching to the choir. Absolutely, I agree with you 100%. I mean, so much of our training as physicians, we get trained on everything, right? At least as much as we can in those 4 years, right? The physiology, the anatomy,
That's
the
right. The
you know,
pathology, just
pathology,
everything.
right? So much, obviously, in the human body is so amazing, and there's so much to learn, but sex is not one of them.
It's not. It's
we
not. But that's how we all got here. That's
That's
why we're all
correct.
here.
Correct. And what's so funny is that we get what? Like, would you say, I don't know, at least in my medical school, I got maybe 2 hours, I think, at most in medical school,
It
right?
wasn't a lot. It definitely was
Right?
not a
We
lot
we
of the
learn we
curriculum.
learn maybe a little bit about the physiology, but not really much more than that. And then, we learn about the research from like the 1960s from Masters and Johnson, right? We don't even learn what's going on now. What is the contemporary thought? What do we think now is the, human sexual response cycle? What is that? And what we've learned is really, I mean, it's very important, right? They were the
Mhm.
forefathers or the people that first came up with this whole idea of the sexual response cycle. But then, there's been a lot of research since, and it's really important that our medical schools start teaching that. And then forget it about residency. Did you learn anything in residency? No.
Mm-mm. No, it was more so,
Oh,
here are some metrics. Let's make sure we cover those vaccines,
yeah,
STI screening,
yeah,
maybe, and then we're done.
nothing,
Like,
nothing, right? So that's family practice. Think about this. I mean,
exactly.
gynecology, like you would think
We would
that
want
I
we would
would
want
get
to send to you all. That's
right, right. And what happens in gynecology? Nope, we don't get it either. So who gets it? I mean, the urologist, and so now we're going through my TED talk, but basically, like the urologists are the only physicians that get even a little bit of training on sexual health, right? We
wow.
don't get any. And I truly believe that the urologists get it because they are a specialty that focuses both on men and women. And we know that medicine for so long has been focused on Caucasian men,
Right.
right?
Right.
And so, things that may be disruptive to their health is what the research has been on. And so, we don't know what we don't know. And so much of it, especially in gynecology, I mean, we don't learn anything about sexual health. It's really, really awful. And,
Really, yes, it
when
is.
women, we don't learn about perimenopause, we don't learn about menopause, at least I
Right.
didn't in my residency. And, when women come to us and ask us about these things,
We're
right?
at a
We're
loss. We just really don't know what to do or how to offer or best help them or who to send them to,
correct.
right?
Because no one wants to talk about sex, right? No physician wants to talk about, they don't want to deal with it.
That's
And so
right.
that's why it's really important that we have these sex med docs, right? And like I did a year-long course with the University of Michigan on sexual counseling and education. And then I became an Ishwish fellow. So, I feel really comfortable talking about sexual health, sexual counseling. I'm an intimacy coach, all this stuff. But that really took time and investing in myself and my own education. And same thing with
That's
learning
what
about perimenopause.
you've done with training. This is coming after the fact and realizing there's an additional need.
Absolutely. That there's a huge void in our training, right? And then when we talk about like perimenopause, menopause, forget it. We don't know anything either. So
No.
again, you have to do additional training, you have to take courses, this and that, blah, blah. So I think it's really important. And I think it's great, Dr. Duggan, that you really focus on this very important topic. You talk to your patients, you make them feel comfortable, you give them, that safe space that they can share their,
Mhm.
their thoughts and desires and what they're doing with you so that then you can really help them to the best of your ability. So I think it's
Right.
fantastic.
And I'll say too is that I believe in starting earlier so that they can learn to be an advocate for themselves.
Yes.
So
Yes.
it's throughout their entire lifespan, whether they're seeing someone like myself earlier on, to whomever they're able to find, say 30s, 40s, and even if they are needing a gynecologist, knowing that they can advocate for themselves, they can
Yeah.
ask these questions, or they'll continue to search for someone that can answer the questions that they have to know that we do exist, that we are here and we're
Right.
here to serve them in these awesome ways. So it's so exciting. It's so
Yeah,
exciting.
absolutely, absolutely. Well, is there any last pearl that you want to share with our listeners or viewers before you go?
I think kind of piggybacking on what I just ended with is that we exist. We
Yeah,
are here. If you have these concerns with these sensitive topics, you can start early. Continue to advocate for your child if you need something for your child, or you're like, I'm not quite sure if puberty is going the way I expect it to. Seek out help for it. And if your initial pediatrician or family medicine person isn't comfortable with it, don't stop looking. Don't stop
right.
trying because we are here. And I'm
Yeah,
so glad that I was able to come on today. And I love your passion for what you do as well, Dr. Lodi. So thank you so much. And you all, we are here. We do exist.
that's right. That's right. Absolutely. Well, thank you for coming on. And so, for somebody that's listening to this and watching you and thinking, wow, she is amazing. I would love to bring my kids and children, or if you're a young adult yourself and looking for a physician, we know that Dr. Duggan is here. So, where are you located? How can they get in touch with you?
Absolutely. So they can start with our website, www.herhealthga.com, or check us out on social media. We're in a lot of different places from IG to TikTok, also to YouTube at Loretta Duggan MD, or Facebook, Dr. Loretta Duggan Her Health. So check us out.
Awesome. Amazing. Well, thank you so much. And thank you for coming on. I really appreciate your time.
Thank you. Thank you.
And well, we are done here, and it's been real and really intimate. And remember, this is not meant to be any type of medical advice. If you have any questions about your health or adolescent health or any of those questions, please speak with your friendly neighborhood healthcare provider. And until next time, this is the Muslim Sex Podcast. So thank you for listening to the podcast, and make sure you leave us a review, share and like the podcast. And if you leave me a review, I'd love to shout you out on social media. So be sure that you share it with all your friends. And thanks for listening.